Our next speaker is Dr. Lisa Fitzpatrick, who is with Grapevine Health. Dr. Fitzpatrick is founder of Promoting Practical Health, Inc., where Grapevine Health was started, and is also a lecturer at the Milken Institute School of Public Health at George Washington University. Dr. Fitzpatrick is an infectious disease physician and CDC-trained medical epidemiologist. Got to give the CDC plug there. And her career has spanned research, clinical medicine, global health, community health education, and patient advocacy. She recently served as the medical director for Washington, D.C.'s Medicaid program as well. Without further ado, I'd like to welcome Dr. Fitzpatrick to the stage.
Good afternoon. So you have been sitting for almost an hour, which means you have to stand up and at least raise your hands and take a breath. And while you're standing, tell the person next to you about the last time you got bad health information. So just do that. I'll give you 30 seconds from my... Go ahead. I know you've had some bad health information. You can tell me. All right. Last chance to take a big breath before you sit down again. Okay. Thank you so much for inviting me to be here. As you've heard, I've had a lot of jobs in the health sector, but what I'm going to tell you about is probably the most energizing, most humbling, and most inspiring work I've been doing, because I get to interact with the ordinary Joe. So I'm going to spend my time talking about a few things. I'm going to go through this very quickly because, as you know, I only have 15 minutes, and then if there are issues I raise, I hope that you will come to the microphone and ask for more information. But the first thing I want to tell you about is why I became passionate about health literacy. This happened in 2005. I was on a panel with some pretty high-profile people like Surgeons General of the United States, past Surgeons General, and after the panel, a gentleman fitting this demographic, he came up to me and he said, "How does someone like me access someone like you on a regular basis?" And the conversation we had after that, I wanted to understand what he meant. It was about not feeling like he could get the information he needed from his doctor. And this is before the internet blew up. I'm older than I look. So one of my responses to that years later was to figure out how you could engage people around health information. So as a test, I created, along with my videographer, Dr. Lisa on the Street. So I'm going to show you a short video clip to give you an idea of what that is. This is my response as a physician trying to get people to think about their health. Oh, I'm going to need your help. Yeah.
Flu last month. Yeah.
I'm Dr. Lisa Fitzpatrick with Promoting Practical Health. In my experience, the most effective way to engage people around health issues is face-to-face.
Flu last month. Yeah. For a week. How'd I get it? I don't know, but it knocked me down hard.
Not cooking food properly.
That's salmonella.
Well, that's...
Every time I take the flu shot, I get the flu.
No.
Okay.
And I don't want one. I see everyone pushing it, and they keep pushing it, and everyone keeps pushing it.
I'm sick of corporate America pushing stuff on me.
Yeah. So you think flu shots are? Is that for all shots or just flu shots?
I'd say most all shots.
Because doctors often speak in a language that people don't understand. Has this ever happened to you?
Pretty much all the time.
Oh.
I'm not. I mean, I haven't went to school to be a doctor. I haven't went to school to be a nurse. So when you say it's using big words, I don't know what you're talking about.
I think it need to be broken down.
Does that happen on a regular basis?
Yeah.
What if the doctor tells you have lumbar strain?
Oh, I would tell him to explain it.
Oh.
I would tell him to explain exactly what it is. Yes. I mean, if it's something that I don't understand, I have no problem with asking.
Yeah.
I'm going to make sure I leave out there knowing exactly what's going on.
For breathing, yes.
Can I breathe with them?
So los pulmones, lungs.
Yeah, liver.
Liver, and what is this underneath the liver? This green thing.
Not pancreas. Oh God, this is so.
The gallbladder.
Gallbladder. I know.
Yeah.
See, I want to go with one or the other.
The difference in the blue and the red. Oxygenated and deoxygenated. You got yourself a doctor on your hands. What do you think? Why is it important for people to know where these organs are?
It dictates what you dictates how you feel. You know, if your stomach hurt, something wrong with your stomach. Your spleen hurt, there's something wrong with your spleen. You know,
These organs
Because if you don't know your body, then how are you gonna use it and keep it? And you might get sick. I mean, you never know.
We know what these terms mean. These terms may be in the media. That doesn't mean people understand the term. But how do you think we can get the message out to them?
The way you're talking to me now, each one teach one and spread the news.
All right. I'm Dr. Lisa. I'll see you on the street. Thank you. So we beta tested a few of these videos, and then life happened, and we put those on hold. We'll be picking this type of activity up again. But in the meantime, we're fortunate to get a small grant from the Commonwealth Fund because we wanted to understand if we were to produce content like this, how do we actually get people to watch it? And as I had many conversations, people commonly asked me, because I'm interested in the Medicaid population, do poor people have phones? Do poor people have access to the internet? I got this question just last week. So I wanted to answer this in a research study because people tend to respond to research. But we also wanted to know other things like, are people going to the internet for health-related reasons, and are they using their phones for that? And if so, what? What are they doing? And then we wanted to know the trusted sources of health information. And in a nutshell, we found, of course, everybody has a phone. I volunteered at a homeless shelter. Almost everyone there has a cell phone. Engagement with digital tools is very low, but the interest is there if we create tools that they want to engage with. But what was most striking to me is that people trust health information from friends and family more than doctors. And that's why I created Grapevine Health. So we focus on patient engagement, health literacy, and community outreach, and some of our partners include Medicaid managed care organizations. We're also working with a local organization called the United Planning Organization, and those are the folks who give out the food stamp benefits. And we can talk more about that if you're interested afterwards. I certainly don't have time to go into a lot of that right now, but I wanted to give you some suggestions from the field. So what are we hearing from people, and what kind of advice are they giving us? First, we've heard a lot about this already today. We have to speak in the language so that people can understand what we're talking about. And here are a few comments I pulled from some of the focus groups we've had. If I can't understand you, I don't trust you. And the second one I heard in the barbershop. He was explaining why it's difficult for him to understand how to take his medicine because his doctor speaks in an accent and he feels like he has to translate because he has an accent. So he's translating. He says, well, I have to translate twice. So I usually get about 50% of what I'm supposed to be doing. And then finally, someone who told me she had an encounter in the emergency room And when she looked at the discharge paperwork, it had this big word on it. So she tried to figure out what it meant, but nobody explained to her what gastroparesis is. But she was afraid her stomach didn't work because that's what she thought it meant. So we have so many stories like this. We've heard a lot about trust today, but we don't measure trust the way we should. We measure things that matter. So how are we going to measure trust? The reason I put this here is because it's somewhat relevant to the trust issue. Some of you know Mandy Chapman from GW. Mandy, raise your hand. She's what I call a cancer maven here in DC. And she sounded the alarm recently because a Medicaid report showed that 47% of Medicaid patients with cancer are being treated. So what's happening to the other ones? So we put together this flyer. This is actually a very new activity, so I don't have a lot of data back, but what we are hearing is that people don't trust the treatment and the healthcare system. So I'm looking forward to hearing more about what we learned from this. We also learned that we have to show up and engage people where they are in their community. We can't keep expecting them to come to us. Why is all of the healthcare system inside buildings where people find these buildings cold, unfriendly, sometimes disrespectful? So one of our outreach events recently, this is Dr. Sarah Horton, the woman in red. She's a cancer doctor here in DC who's very skilled at health communication. And here are some of the things we heard as we walked the street talking to people, because people feel very comfortable asking questions when you show up in their environment. But the one I want to point out is the third one. Having cancer is stigmatizing. People would whisper sometimes when we were asking them, well, what do you want to know about cancer? She had to tell them about screening, saving lives, because people didn't recognize that being screened early could mean prevention of cancer. She also found most people didn't know their family history and why that was important. So these things are really important for us to continue focusing on, specifically with respect to cancer. And the last point I want to make today, particularly because we're talking about communication, is that the healthcare system, I think, has traditionally been afraid of social media. And I think that's a mistake, because there's a lot of misinformation. We've heard about it all day. Why aren't we countering the misinformation? I had a health reporter tell me when I asked him, why aren't you covering these stories you're hearing about vaccines? And he said, well, I think that's a fringe community, and we don't want to give it life. Well, if we don't give it life, if we don't put, as I say, the truthful information on the grapevine, it's really hard to counteract this information when it spreads like wildfire. So as an example, I just wanted to show you, people are using social media. This is someone, you can see she's crowdsourcing information about her rash. She woke up in the morning and had a rash. And at the very bottom, you can see I told her to call me. So I recognize the rash. She goes and she takes Benadryl, and she calls me 30 minutes later and is thanking me for saving her $150 because she didn't go to the ER. But here's where she's given all the reasons why she wishes her doctor would provide that kind of service. Why aren't we doing this routinely for people? And to answer the question, or to give more support for the need for social media, we looked at what people were doing on their phones in the Commonwealth study. People are scrolling. This is a shot I took on the Metro. Look at how many phones are out on the ride, on the Metro ride. So we've started to disseminate these flyers, just asking people, send us your health information questions. We want to know what people are thinking about. And this is one of the responses to the social media posts related to the cancer flyer. So you see someone's already asked a bunch of questions. There's a lot of confusion out there, and I think this would be a very impactful way for us to help educate people, not just about cancer, but about health issues. So what my recommendations to you, the first one is we have to train people from the top to the bottom of our organizations about how to address health literacy. And this is including doctors. We are some of the worst offenders. I heard the discussions earlier about the need for training, but I think we have to be very specific about the kinds of trainings, and we have to expose people to the environments where folks are so that they recognize how important it is to speak in people's language. Why are we so afraid of social media? I think we have to assess that as well. Is the threat real? Are we more concerned about risk than we are helping people? And in some of the organizations I've been in, it's because it's uncharted territory, people aren't sure they want to venture into social media because of what could happen. Well, look at what's happening because we're not there. And then finally, I think we have to focus on trust. How do we do that? How does your organization do it? If you aren't talking about trust, you absolutely should be talking about trust. Because this is the currency that matters, especially for the people we're working with on the ground in Grapevine Health. The people, the 53% who've been diagnosed with cancer, and they're not in treatment. I would venture to guess we're going to find that trust is the central issue for why they're not being treated, not communication. And finally, I just want to encourage you to challenge some of the assumptions you have about what people know about health information, because I guarantee you it's a lot worse than you probably think. So with that, I'll stop because it looks like I'm out of time. And here's my contact information if you want to follow up or even come and do some outreach with us and talk to people in the community. Thanks.